is in the middle of menopause. And you know what happens is women going that you would go, okay, if you're experiencing these symptoms that may flag that there might be some changes going on to the kidney function. Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic Dr. Fiona Chin, co-founder of Kidney Disease Solution, Kidney Coach, and our flagship products from Kygenesis. And I'm joined again today by one of my favorite guests, Dr. Alexander Grinberg. Dr. Grinberg is hello. I'm always so glad when you join me. Dr. Grinberg is a practicing physician up there in San Francisco in the US, working with patients in the area of longevity, lifespan, extension, personalized anti-aging, nutritional optimization, lifestyle medicine. So very, very holistic in what he does. He's not only a practicing MD, but he's also got a background in virology. He's also got psychiatry background. He started his medical degree when he was 16, which is just crazy for me. So he's been doing, this is what he's dedicated his life to. In fact, Alex, I think we'd spoken about that you became almost obsessed with longevity and anti-aging from like the age of like 6 or something. So you've really, this has been your life work. Let's dig into what happens in menopause. What is that process that as women joyfully get to go through, and what happens in that? And then walk me through potentially the connection to chronic kidney disease from there.
So I'll briefly give some formal definition, formal knowledge, and we can proceed to very exciting things that can hopefully benefit everyone. So formally menopause means the 12 months, absence of periods for 12 months, and a raise of the levels of FSH, follicle stimulating hormone. This is basic medical definition of menopause.
So are there certain symptoms that women may experience? I mean, what should women look out for? So someone's about to go through or is in the middle of menopause. And you know what happens is women going through menopause are just thinking about hormones. They've got the hot flushes, maybe the mood changes, dryness, loss of libido. But are there other sort of things that you would go, okay, if you're experiencing these, you need to get your GP or your OB/GYN to actually start thinking about kidney function? What sort of, are there any symptoms that may flag that there might be some changes going on to the kidney function?
Yes. First, a very simple one, rapid weight gain. And it's as easy as a measure one's waist once in a few weeks. And if the patient sees that there is correspondence between onset of menopause and rapid weight gain, it's alerting sign for metabolic syndrome, for CKD, definitely for diabetes, and they are all interrelated, and some other conditions. Sign 2, increase inflammatory signals. So if more joint pain, allergic reactions, skin rashes, I would consider it like kind of starting on autoimmune phenotype pathway. And probably people know involvement of estrogen and steroid hormones in the mitigating symptoms of autoimmune conditions, but it's a separate issue. Then third would be as simple as checking blood pressure. If average blood pressure is above the level it was pre-menopause or before it started, it's also alarming sign. But also here we need few words. Now many physicians, integrative medicine, consider pre-menopause and as important target conditions to treat and to take care of as menopause as well. Just wanted to add about this because usually proper attention there and proper help there can offset the age of onset of menopause and also prevent people from developing conditions that were related to gradual decrease of the level of estrogen even before it became like manifested as menopause.
Yeah, fascinating. They were really good, clear tips. And it's funny because I would say in patients that I've treated for menopause, 60 to 70% of them are rapid weight gain. That's, sometimes a symptom that bothers them the most. So, any woman out there listening, and it is, really common in menopause, that, to make sure that you're looking at metabolic syndrome and how that's affecting kidney function. Dr. Grinberg, thank you so much. Now, if anyone wants to contact you, infinityepigenetics.com, I'll put the link below. Dr. Grinberg is in San Francisco, but he does telehealth because I send my really complicated patients in Australia here to him. So wherever you are in the world, he can definitely work with you. Like I say, one of the most knowledgeable people when it comes to peptides. So if I've got any patient where I'm like, they need a complicated peptide protocol, I'm sending them to Dr. Grinberg. So if you want to know more about what we do, please head to www.kidneycoach.com. You'll also find us on Instagram and Facebook under the same bits of information. Remember to hit subscribe and like. That way you'll get notified anytime we put up more information. And if you have questions for Dr. Grinberg, please put them in the comments section below and I will get them to him and answer them for you all. Dr. Grinberg, thank you so much for your knowledge, your time, your wisdom. This has been a really informative and great podcast, and hopefully we'll answer all those questions that my menopausal women have had when it comes to CKD and kidney disease.